Hi everyone, and welcome to A&P with Dr. O. Now we're going to take a look at a heart specimen, and we're going to do a little bit of a dissection as well so that we can see both external and internal structures of the heart. So the first thing that we can notice on the heart is we can notice that there is this pointed tip, and that is known as the apex. And then if I pick the heart up a little bit, it will help us to find our auricles, which are these flaps here, these ear-like flaps. And then that allows me also to identify this as the right atrium and this over here as the left atrium. Now, beneath the atria, there's a groove, and that groove is known as the coronary sulcus. And within those grooves, we have the coronary arteries. So that's where the coronary arteries would be within that groove, that coronary sulcus. And that marks the division on the outside between the atria and our ventricles down here. So this would be our right ventricle, and this would be our left ventricle. We can also see several vessels as well. And I tried to clean some of the fat away so that the vessels would be a little bit easier to see. And I'll go ahead and kind of prop the heart up for us as well. What we have here is we have a portion of the aorta, and this would be the brachiocephalic trunk. We can feel how tough and thick it is because blood is going to be pushed through our arteries and especially the aorta at a much higher pressure. So there's our aorta. And then here we have our pulmonary trunk, which would give rise to our pulmonary arteries. If I kind of turn the heart a little bit, we can still see that right auricle on the right atrium. And then we can see a thinner vessel here. It's not as thick, it doesn't feel as tough as these arteries that we were looking at a moment ago. And that is a good indicator that this is a vein, and this indeed is going to be the superior vena cava. And one of the things that you can do in lab is you can actually take your pointer and put your pointer through these openings, and after you've cut the heart open, then you can look inside and see where your pointer goes, because the superior vena cava is going to bring blood to the right atrium. The aorta is going to take blood away from the left ventricle. The pulmonary trunk is going to take blood away from the right ventricle. So that's just kind of a little trick when you get to lab when you're trying to identify these vessels. If we look at this posterior view of the heart, we can see this pulmonary vein right here. We're going to go ahead and we are going to make a frontal or coronal cut, and then that way we can see some of the internal structures of the heart. Now that we're taking a look at the inside of the heart, we can see the myocardium, so that's the middle muscular layer, and then you can see it's kind of shiny in the ventricle here, and that layer of innermost tissue is known as endocardium. And we can see that the left ventricle, the myocardium, is going to be a little bit thicker than the myocardium on the right side for the right ventricle. So this would be the right ventricle here, and then over here we would have the left ventricle. And if I kind of open up the heart wide, we can see especially well the valve that's going to separate the left ventricle from the left atrium. And one way that you can kind of remember the difference between the valve is rat versus lamb. Rat would be right atrium tricuspid valve, and then lamb would be left atrium mitral or bicuspid valve. So this is going to be the bicuspid valve because we're on the left side, and then the tricuspid valve is going to be over here on the right side. So the valves attach to these papillary muscles via these chordae tendineae. So we got these chordae tendineae here, and they're made of connective tissue. They're really strong. I can pull on them. They don't even, break just by me pulling on them with the probe. So it's really strong connection between the valve and this papillary muscle here.